More than 1 million people in Michigan are now unemployed due to coronavirus.
Yeah, a good portion of those also have lost their health insurance. Fox 17's Aaron Parsegian joining us from the newsroom with some advice on what you need to do if you find yourself uninsured in today's Rebound Report. Aaron?
Yeah, Derek, Annie, most people, of course, have their health insurance tied to their employer. When you suddenly lose your job, losing insurance is another tough blow. But we have some tips that could help save money on your premiums and prescription costs.
According to industry experts, up to 35 million Americans could lose their health insurance over the coming weeks. And with no coverage, many are worried about affording prescription costs. One viewer writing Fox 17, quote, "I'm an insulin-dependent diabetic who cannot get medications due to the fact that I do not have health insurance."
This is one of those really difficult sort of aspects of collateral damage we're seeing from this pandemic that we're in.
Dr. Holly Phillips, a board-certified internist, says if you like your old insurance, you are able to keep it for 18 months under the COBRA Act, but it is costly.
Now, some good aspects of the plan is that it does offer a lot of stability in that you get to keep your doctor, for example, and you don't have a disruption in your health care. But it can also be expensive, and that's because the individual or the patient may be required to pay the entire premium, whereas when they were employed, they shared that premium cost with their employer. But thankfully, there are some other less expensive options still available.
Dr. Holly says the first place people should look is the Affordable Care Act. Here in Michigan, people have 60 days after losing health care coverage due to a job loss to qualify for the special enrollment period. That includes options through the ACA Marketplace, Medicaid, or the Children's Health Insurance Program.
They do allow you to shop for different plans that can kind of suit your needs and your level of income. So if you've suddenly found yourself jobless, they can be very inexpensive because they can cap premiums if your income is in fact low enough.
Another option could be through Priority Health. Last month, they established a new option that provides combined same-day coverage with ACA special enrollment to bridge any gap. As for those prescription costs, Dr. Holly says to make sure you are taking the generic version of the drug you need.
Generics are almost always less expensive than the brand names and, of course, just as effective. There are also some tools out there to help you save.
One of the tools is the app RX Saver. It shows users the lowest price of prescription drugs at pharmacies near them. They also have coupons available.
A lot of us aren't aware that different pharmacy chains actually charge different prices for medicines. You know, it sort of seems like they would all be one price, but it turns out that they're not. So RX Saver can show you where the lowest prices are near you, so you can make sure you're paying the least amount you can.
And to see if you qualify for the Affordable Care Act special enrollment, you can head to healthcare.gov or call 800-318-2596. For more about the new offering from Priority Health, you can head to their website or call 833-514-1116. And for that app that shows the best price for your prescriptions, just search for RX Saver on the App Store or Google Play. And as always, you can join the conversation about saving money and talk with our team directly on the Rebound West Michigan Facebook page. Live in the newsroom tonight, Aaron Parsegian, Fox 17 News.
All right, Aaron.